Hello, welcome back to the show. Yes, you're still with me, Aisha and Sasha.
Yeah, we got the names right.
I know, we did. It's a Monday, okay?
That explains a lot.
It does indeed. Anyway, you know what, before the commercial break, we spoke about the brain and nutrition. Today we'll talk about, right now, we'll talk about the back. Do you know that, obviously, I think back pains is one of the most common complaints faced by everybody at just any age. And there are many types of back pains out there, or causes. So, you know, it's not just, you know, one thing.
Yeah.
So
it could be a variety.
I know, there are tons of stuff. So anyway, we've sent our team out to do a little bit of a research on the kinds and the types of back pains that you might be suffering. So let's take a look at this.
There are about 12 to 53 new spinal injuries per million population in the developed countries every year. In the United States, at any one time, there are 721 to 906 people with spinal cord injury per million population. The rise of new spinal cord injury is expected to be much higher in our country. For example, in the neurosurgical service in Sarawak General Hospital, there is a case of spine injury every month for patients admitted with head injury. There are more men injured compared to women in a ratio of 3.4 to 1. Typically, these patients are young, and 2/3 of these occur in individuals less than 30 years of age. Motor vehicle accidents account for more than half of the spinal injury cases around the world. This, however, will vary from country to country. 20 to 57% of people with spinal cord injury also have significant injuries elsewhere. It's important to understand that back pain is a symptom of a medical condition, not a diagnosis itself. Many conditions and types of injuries can cause back pain, which can be acute or chronic. Acute back pain usually affects the lower back and lasts for less than 6 weeks. Chronic back pain, which is lasting longer than 3 months, can have other causes like arthritis, bulging disc, degenerative disc disease, degenerative spondylolisthesis, failed back syndrome, herniated disc, myelopathy, nerve compression, osteoarthritis, osteoporosis, ruptured disc, sciatica, scoliosis, slip disc, spinal stenosis, sprains and strains, and tumors of the spinal cord. But what actually causes it to happen, and how can one prevent it from happening?
Yes, there you go, ladies and gentlemen. That's a very, very long list of potential problems that you can have, whether it's with your back or your spine. So we have with us here an expert, Dr. Chooi Seng, who will be sharing with us a little bit more about the different types, and as well as, most importantly, how can you prevent them? Good morning, doctor. How are you?
Fine, thank you. Thanks for having me here.
Thank you so much for joining us. Now, I'm sure a lot of our viewers, after seeing that list, are like, oh no.
Oh my goodness.
There's
or
like 20 stuff that I could get.
Yeah, exactly. Or they will be actually ticking off going, yes, I have that, I have that, I have that. So what are some of the main causes of the injuries that we saw on the TV just now?
Yes, I think low back pain is a very, very big topic. And so the aim is to always try to find out where the cause of the problem is. But by far, the majority is due to muscle strain. That is when you have an imbalance between form and function. That is when you have a okay body, but the problem is your body is not coping very well with that particular task. Or your body is okay, but you're doing too much of that particular task.
So it's like an overuse,
overuse injury, or repetitive overuse injury.
So that's the most common cause?
Yes.
See, earlier in the package it said that a back pain is a symptom of an existing condition, so that would be a milder case as compared to the acute or more severe cases?
Not always. By far the majority of the back pain are due to things that are what they call low back pain non-specific. That is when they cannot really find what's going on. You do your x-rays, you do your MRIs, and there's nothing wrong. And so that's by far is the majority. And so that's why the magic number, 6 weeks, comes into play.
So if anything goes on for longer than 6 weeks, then you need to look deeper into it and see if there's something else.
Yes, correct. And so my advice to most people would be if things don't get better after 2 to 6 weeks, you really should go and see a doctor. And usually, most of the doctors will be thinking of the 3 terrible things that can happen to you that could give you back pain. One is infection.
An infection of?
Of the spine.
Of the spine
You can
itself.
have infection of the spine. You can also have tumor in the spine. Or you could have significant trauma. A patient could have had some injury and could have had some missed fractures or torn ligaments. So these are the 3 things that we look for.
Okay, so there's the overuse injury. Like, for example, I pick up this table every day for a year, and so so my back will hurt because of that.
Correct.
So that's just over time. However, the other option is where I fell on the table and severely damaged my back. So what are the 2 different types of treatments that you will approach these 2 scenarios with?
Okay. Usually, for people with the OK form, OK spine, but the task is too great.
Too great.
So, well, usually we'll tell people to do adequate warm-ups, stretchings, and then gradually increase the demands on your spine. And eventually you'll be able to do that particular task without any issues. And the problem with when the task is or when your form isn't adequate, there's something wrong with your spine. Well, you need to get it fixed. That's in a nutshell, yeah.
Now, is it true that this is because I do suffer from lower back pain, and I've been told that one of the best ways to help that is to actually increase the strength in your core, to whether you do a lot of core exercises, you go to the gym, planks, it's supposed to be very good. Is that true? It's because the abdominal wall acts as a kind of corset, so therefore it stabilizes the back. Is that in any way, is that correct? Or, are there other methods which, people should look into and, not try to be, just go all out?
Yes, actually, a lot of people forget that our back muscles are one of the strongest muscles in our body. It helps to keep us erect. And the way we were made to sit, walk, and run. And so you really need to fine-tune it every few months or years through exercise and stretches. But in my opinion, I think the most important thing is actually weight loss.
Weight loss is the best way.
Correct.
So keep your body weight within the usual BMI range, with, the correct according to your height and all that.
And that usually helps a lot with back pain.
Now, I was once told by somebody that no spine is perfect, obviously, and then we will definitely have some sort of a pain. Could this be because of, like you mentioned to Seng, Doc, that our bodies are made to walk, run, stand, sit.
Yes.
However, we're not made probably to sit for 6 hours hunched over a computer desk or driving in a traffic jam. We spend half of our lives behind the wheel driving. So are these some of the reasons why that we're just we'll always just have back pains?
Correct. Now this is issue of posture. So if you have incorrect posture or inadequate posture for prolonged periods of time, yes, you will get back pain.
And now, what is good posture? I think, there's a lot of belief that good posture is a very straight back. But that's not quite true either, is it? Because the spine is supposed to have the natural curves, going this way.
Yes.
So what is the best way to think about keeping a correct posture?
For us doctors, we have a way of approaching this, but I think generally you could say the natural posture is the good posture. That's when you stand and you don't stoop your shoulders, you don't hunch, or you don't arch your back too much.
Another one,
simply.
One that I was taught many, many years ago, this is actually through dancing, is to think of your head as floating up, so that you don't keep too much of the weight in the lower back. Would that be a good image to have as well? To keep it lengthened.
I've never heard of that one before.
Yeah, to keep it more lengthened, as opposed
string
to so lengthened as opposed to compressed.
Perhaps, yes. But I think you're right when you say that a straight spine isn't the answer. Yes, I would say a natural, balanced posture, which means from the front you don't have any tilts, shoulder tilts. You don't have any pelvic tilts, and when we look at you from the side, you don't hunch forward too much or you don't arch backwards too much.
Sometimes it's due to habits that you pick up throughout life. I mean, maybe as a kid you were kind of shy, hence the reason for hunching over. So what kind of exercises can one do to actually help correct the posture?
You can do a lot of back strengthening exercises, actually. But sometimes we are humans, and it's our nature to try to find the most easiest excuse. So when I see a patient like this, you usually need to find out if there is an underlying cause. It's always easy to just blame posture or anything, you know, school bags, computers.
Talking about that, school bags.
Yeah.
I mean, you know, kids nowadays are really laden by extremely heavy school bags. So this will actually have an effect in the long term?
Yes, I was actually Googling this last night, and there are a few papers that have come up, and a few British studies have found that actually they recommend 10 to 15% of the child's body weight. So the load should not exceed about 15% of the body weight. Thus, then the child might be at an increased risk of back pain. And when these children get back pain at that age, they will be about 4 times at greater risk of developing back pain as adults.
Okay, so basically don't carry too many books.
Yeah, that's why I've seen in Malaysia a lot of people have
this pulley, this stroller bag.
So that's a good idea.
Yeah,
it's a better idea.
So keep things, so don't carry it so much on your body, or as you know, it used to be the fashion at one point, just sling it over your shoulder. I suppose you're trying to look cool, right? And you know, walk along, but to keep that heavy load off your body.
Yes, correct.
Anyway, there you go, a few ways to help avoid back pains. Anyway, thank you very much, Doctor, for being on the show and helping us understand a little bit more about back pain. Once again, although we did give a long list of the many causes or conditions that could be causing that pain in your back, but as Doctor said, that some of the biggest causes are actually because of overuse. It could be because of our posture, and I think we just need to look back. If it's like longer than 2-3 weeks, then yes, go see a doctor.
Absolutely,
that's the most important.
But we have more coming up for you after the break, so don't go away.